Good day everyone and good day sir. I am Emily Jose and we're going to report the intraoperative nursing management, specifically the objective number 1 and 3. So for this management, we were going to learn the objective 1 to 8, which is to describe the interdisciplinary approach to the care of the patient during the surgery. And of course, to describe the principle of surgical sepsis. Describe the rules of the surgical team members during the intraoperative phase of care. Identify the adverse effect of the surgery and the anesthesia during the intraoperative period. And of course, to identify the surgical risk factor related to the age specific to population and nursing intervention to reduce this risk. Compare various types of anesthesia with regard to uses, advantages, disadvantages, and nursing responsibilities, and identify the use of nursing process for optimizing patient outcomes during the intraoperative period. Describe the role of nurses in ensuring patient safety during the intraoperative period. So, now we're going to discuss the objective learning objective number 1. So we have to describe the interdisciplinary approach to the care of the patient during the surgery. So I would like to inform that intraoperative um, management is during the surgery of the patient. So before under the OR or operation room. So disclaimer, any of the image or video and clips or photos or images had been shown, it's not intended to copyright. All this is created to the rightful owner. So, so under this interdisciplinary approach, we were going to view or cite and we're going to overview the how technology has been evolved throughout this year and how this the advantage of the healthcare and disadvantage. So we're going to view. So as you can see at the video, we were going to um, observe or identify how the technology has been made and what is this force and what is the advantage of this and the disadvantage. But of course, intraoperative experience has undergone many changes throughout the year that make it safer and laser for the patient and of course the physician. How does it make safer and less disturbance for the patient? Of course, it will make safer for the patient because of this advance. That's why it's called advance because it was a great help for the patient and the physician. One of these advantages is the use of computer. So computer is one of the technologies. So the function of computer is to restore, um, to store documents, files that will be specific for the patient. So with the help of the computer, the personal the personal history or identification information of the patient will make safe. So it will make it simpler for the patient or for the nurses and it will make safer for the patient. So that's what makes the technology helpful for that for this during this era. So we're going to play it again. So how does it make less disturbance for the patient? One of the example is the bed or the hospital bed. As you can see, the hospital bed has the restraint both sides. So this restraint will help the patient to lie down comfortably without having worried that he or she might fall anytime because of the restraint. That I mean because of the side rail, not the restraint. Of course, the restraint is also helpful for the patient for the elderly patient, for example, avoid falling. So, and now what the technology make it advantage for the patient? Of course, having those advantages, one of the advantages, it will also make disadvantages or complication or risk factor or adverse effect for the patient. How? First, we can cite an example for the example, the laser or the cause of the X-ray that will cause radiation. They are not safe for the radiation, specifically for the elderly patient um, because of the loss of strength, of course, the aging of brain, stress, they can cope up, they can't even handle the loss of ability. So that is one of the example of the risk complication of having these technologies. So after that, despite of disadvantages and advantages of these technologies, of course, one of the main goal of the one of the main goal or aim of the physician, medicals, doctor is to promote high quality healthcare standard. Of course, without that creation of technology, with the creation of technology, they are always promoting what is the best for the patient. So that is the learning or objectives of our number one. So I hope that you learn. Now let's proceed for our learning number three. I mean number two. Thank you.
Good afternoon, sir. I'm Evelyn Kaysani. So, my report, which is second objective learning, it's all about the principles of the surgical asepsis. Uh, when we see a surgical asepsis, it is all about the preventions of the infections or avoid the precautions. So, the principles of the surgical asepsis include the repels, the absence of the infectious materials and infectious surgical asepsis, and the absence of all microorganisms within any types of the invasive precautions. So inside the surgical room, it should be a clean, and so all the materials or equipment using for the surgical, it should be sterile, and to avoid the contaminations of the inpatients to one another in each, and especially also into the patients. So as you can see in the features. So next is the surgical area is divided into three zones, which is the unrestricted zone. So the unrestricted zones are those in which the personnel may wear streets and clothes, and the traffic is not limited. Second is a semi-restricted zone. So semi-restricted zone such as a processing and the storage area for the instruments and all the supplies, as well as the corridors leading to the restricted area of the surgical attire, and the patients must wear in the gowns or the coverings, and use a PPE, which is all the equipments here inside the semi-restricted zone, and also all the exterior here, which is sterile. So next is a restricted zone. When we say a restricted zone, include the operating room and clean corridor and scrub sinks area, the surgical attire and mask and required in this area when these are often necessary supplies or the scrub persons in the area. So next is we have the surgical environment. The surgical environment is known for its historic appearance and cold temperatures. It should be cold temperatures. The surgical site is behind the doors and access of the limited to authorized persons external precautions. And also surgical environment. Um, the operating is so it's also called the operating room. It's a sterile organized environment. As a healthcare provider, you may be required to enter the OR during the surgical procedures or to sit up before the surgical procedure. What's important that it should be the arrange or manage clean and safety surgical uh, inside the room or which we call surgical environment because even the minor disturbance um, its internal environments of the operations room can have a serious manifestations and the comfort effectiveness and safety of aides and inhabitants uh, a call we will ventilations climate. So that's all for the surgical environment. uh, Surgical environment, it should be cleaned and authorized of the person and also cold temperatures. That's all for the second object.
And now we're going to explain the learning objective number 3, which is to describe the rules of the surgical team during the intraoperative phase of care. So, who is the in charge of the operation? Who is his or her assistant? So, we're going to describe each all of this surgical team. So, for that, I'm going to slide the image and video presentation. Then I'm going to describe each rule. Okay, so we're going to play. And now, let's identify the different parts of the surgical team. To have a proper and effective team, communication between all team members should be effective itself and responsible. The first member of the team should be the surgeon. He or she is the attending physician who is responsible for the patient. And of course, the patient itself is involved or part of the team. Without him or her, the surgery is nothing. As the surgeon made the decision to operate the patient, before getting into operating room, the patient should complete the lab or any kind of test. That is not the case with emergency surgery, such as trauma, but the majority of the surgery are planned in advance, sometimes called elective surgery. The surgeon entered the operating room once the patient is under the anesthesia and ready to be operated on. The surgeon performed the surgery and must remain by the patient his side until he or she incubated. The surgeon operates in a sterile field to minimize the risk of surgical infection. On the other side of the drape is the anesthesiologist. He or she might be the guardian angel for the patient as they approach in a scary way. He is another member of the surgical team, just like the surgeon. The anesthesiology will visit the patient in the pre-operation, but rather than the procedure, they will focusing on explaining how they'll keep the patient comfortable during the case. There are different types of anesthesia, including the general anesthesia. Another type of anesthesia is sedation, where patient is deeply sedated and often doesn't remember the procedure. And another type is the local and regional anesthetic. Doesn't interfere with the patient consciousness, but rather numb the area that the surgeon will be working on. The surgical first assistant is the person helping the surgeon performing the case, also scrubbed into the sterile surgical field. The surgical first assistant can be a resident, physician, assistant nurse practitioner, certified surgical assistant, and medical student. It's the responsibility to assess the surgeon in performing the procedure, which include a lot of retractings and sanctioning, and performing other supportive measures for the surgeon. Being a good assistant requires knowledge of anatomy and physiology, surgical handling of tissue, understanding surgical instrumentation and its use, and the nature of the procedure. The first assist should also be skilled in suturing, positioning, sterile technique, and prepping and draping, and the use of splints and casts. The scrub nurse is also scrub in the surgical field and is the one preparing, organizing, and providing the various surgical tools and instruments to the surgeon and the first assistant during the case. Prior to the case beginning, the scrub nurse gathered the necessary supplies, including the set of surgical instruments needed for the particular type of procedure. They'll be the first one to scrub in and set up the sterile surgical field for others to join, helping the surgeon and assistant wear their sterile gown and gloves. The circulatory is the point person in helping assess the surgical team outside of the sterile surgical field. Along with the scrub nurse, they are also responsible for the gathering supplies, sterile equipment, and tool set needed for the surgery and anesthesia. They also manage the documentation at the computer before and during the case, including verifying the patient ID, who all is in the room, getting the patient comfortable with the warming blankets and the like. Together with the scrub nurse, they help the surgeon and assistant get gown in sterile fashion, and it's common for them to also help the surgical site with washing agent and other prep materials. Towards the end of the case, they'll ensure an accurate count of the sutures, needles, sponges, and lamp pads. Together, all parts of working in harmony translate to a successful and nearby seamless experience for the patient care and safety. So that's it on what is the role of surgical team. So I would like to inform that I do not own any of the clips of this video. It is created to the rightful owner. It's not intended to promote copyright. So I hope that you learn what is the main role of the surgical team. So thank you.
Okay, so good day. Um, I'm Sambrano Angelica, and the first is for the learning objective is identify adverse effects of surgery and anesthesia during the intraoperative operation. So we have potential of surgery and anesthesia. This risk includes the following allergic reaction. First is allergic reaction. So as you can see here in the screen, so the first picture is the allergic reaction. So allergic reaction is a exaggerated sensitivity. The next is the cardiodysrhythmia from electrolyte imbalance or adverse effect of anesthetic agent. So the cardiac dysrhythmia can be used by many things, includes problem with the heart valve. Okay, the next is the myocardial and circulatory collapse. So as you can see in the second picture. Okay, the next is the central nervous system. Central nervous system agitation, seizures, and respiratory arrest. So as you can see in the third picture in the screen. Okay, so next is the agitation or disorientation, especially in elderly
elderly patients. So two common causes of disorientation are delirium and dementi. Okay, the next is the hypoxemia and hypercarbia from hypoventilation and inadequate respiratory support during anesthesia. So the hypoxemia occurs when the level of oxygen in the blood are lower than normal. Okay, the next is the laryngeal trauma, oral trauma, and broken teeth from difficult intubation. So the laryngeal is laryngeal trauma is injury from the voice box or the larynx. Next is hypothermia from cool operation room temperature, exposure of body cavities, and impaired thermoregulation secondary to anesthetic agent. So the hypothermia is caused by prolonged exposure during hypothermia is caused by prolonged exposure to very cold temperature. The next is hypotension from blood loss or adverse effect of anesthesia infection. So blood loss can be used a sudden drop in the blood pressure result in trauma, or compression in nerve can result in nerve pain. Then next is the thrombosis from compression of blood vessels. Then so that's it. The next is the malignant hypothermia secondary to adverse effect of the anesthesia. So the malignant hyperthermia is a severe reaction to certain drug used for anesthesia. The next is the nerve damage, skin breakdown from prolonged position. So as you can see the picture of the lady, she have skin breakdown. Okay, so that's all for my report. Thank you.
So, Assalamualaikum sir, I am Darwisa Isaman. So, I'm here to discuss the objective number 5, identify the surgical risk factors related to age-specific populations and nursing interventions to reduce those risks. So, for the potentials intraoperative complications, so which is the nausea and vomiting, malignant hyperthermia, anaphylaxis, hypothermia, hypoxia, and target area include the surgical site infection. So for the nausea and vomiting, so both nausea and vomiting are very common symptoms and can be caused by a wide range of factors. They occur in both children and adults, although they probably most common in pregnant women. So most adults rarely vomit when it does occur. Bacterial or viral infections of a type of food poisoning, so usually cause vomiting, and vomiting can also be result of the illness, especially if they lead to headache or high fever. So kakaroon din siya ng sakit dito, taas na lagnat. Then malignant hyperthermia is called pharmacogenetic disorder because reactions is caused by specific drugs. If given these drugs, people at risk for malignant hyperthermia may experience muscle rigidity, breakdown of muscles, and a high fever that may exceed 110 degrees Celsius Fahrenheit, 43.3% Celsius, increased acid levels also in the blood and other tissues, and a rapid heart rate. Then next is the
anaphylaxis. So anaphylaxis, this is the severe potential life-threatening allergic reactions, and it can occur within seconds or minutes of exposure to something you're allergic to, such as peanut or bee sting. So the signs of this anaphylaxis is the brain is feeling like something awful is about to happen. Then the mouth is becoming swelling, the lips and tongue or throat. Then the lungs is shortness of breath, trouble breathing and wheezing. The heart is dizziness. So the skin is it make rashes, itching and hives. So stomach, you may feel vomiting and area, and also the stomach pain. Then for the hypoxia, so hypoxia, this is the low oxygen level in your blood. So for the hypothermia is becoming is caused by prolonged exposure to very cold temperature. When you expose to cold temperatures, your body begins to lose heat faster than it produces. So the symptoms of hypothermia is becoming confused or disoriented, losing consciousness, slurring speech, dilated pupils, low pulse, and breathing slowly, blue skin, losing coordinations, and fumbling with tools or other objectives, and difficult walking and standing. So for the hypothermia, so for the hypothermia is so next is gerontologic considerations. So for the gerontologic considerations, this is a biologic variations or of particular importance of elderly patients include the age-related cardiovascular and pulmonary changes, decreased ability to respond to stress. So these gerontologic considerations is the older adult patients are in increased risk for complications of surgery. So anesthesia due to increased likelihood of coexisting condition, aging heart and pulmonary system, and also decreased hemostatic mechanism and changes in response to drugs, anesthetic agent due to aging changes, decreased renal function, changes in body compositions of fat water. So for the clinical manifestations, so we have tachycardia, heart rate greater than 150, sympathetic nervous stimulations, hypotensions, temperature. So these clinical manifestations, this is physical result of type of illness or infections. So ito yung parang minomonitor and naobserbahan na ng nurse, ng mga nurse kung ano yung sakit ng isang pasyente. So nursing management. So this nursing management consists of the performance of the leadership functions of governance and decisions making within organizations employing nurses. So this is include the process common to all management like planning, organizing, staffing, directing, and controlling. So for the medical management, the increased metabolism, reverse metabolic and respiratory acidosis. So for this medical management is also known as a medical case management. This process simply refers purposes of treatment of disease, injury, or disorder. So, and then the medical management can refer to management of how medical treatment is delivered on a larger scale. So, say at the hospital,
Then, our health system wide level to meet the needs of all the patients. So the responsibilities of the medical management is manage healthcare staff and their responsibilities. So improve patient care and patient experience. Then manage the storage and privacy of the patient's informations. Then ensure that everything within the healthcare organizations run smoothly. Then ensure that the health services within the organizations are effective and utilized appropriately. Then ensure healthcare professionals receive continuous educations in their respective fields. Then last is coordinate the integrations of care to fulfill patient needs in a cost-effective and satisfactory manner. So that's all for the objective number 5. Thank you.
Assalamualaikum warahmatullahi ta'ala wabarakatuh. I'm Shara Isangkula and my report is the main types of anesthesia. So the learning objectives is compare various types of anesthesia with regard to uses, advantages and disadvantages, and nursing responsibilities. And we have the main types of anesthesia, which is the general anesthesia, regional anesthesia, moderate sedation, monitored anesthesia care, and local anesthesia. So, general anesthesia is an anesthetic used to induce unconscious during surgery, and the medicine is either inhaled through a breathing mask or tube, or given through an intravenous or IV line. And under general anesthesia, the patient is unable to feel the pain and may also have amnesia. And we have the fourth stage of general amnesia, which is the beginning anesthesia. So in this stage can be initiated in a preoperative anesthesiologist holding area where the patient is given medication and may begin to feel its effects like warm, dizziness, and a feeling of detachment may be experienced, but has not yet become unconscious. So this stage is usually described as the induction stage, which is patient are sedated but conversational. And stage 2 is excitement. So this stage is marked by features such as disinhibition or loss or reduction of an inhibitions, and delirium, a mental state in which you are confused and not able to think or speak clearly, and uncontrolled movement, loss of eyelash reflex, hypertension, and tachycardia. So airway reflexes remain intact during this phase and are often hypertensive to stimulation. And the stage 3 is surgical anesthesia. So at this stage, surgery can take place. Your eyes stop moving, your muscles completely relax, and you may stop breathing without the help of machines. The anesthesiologist and lungs to work. So the anesthesiologist will keep you at this stage until the procedure is over. And the stage 4 is medullary depression. So in this stage, if you get too much anesthesia, your brain will stop telling your heart and lungs to work. And it's rare with modern technology, but it can be fatal. So inhaled anesthetic agent include volatile liquid anesthetic agents and gases. So produce anesthesia when their vapor are inhaled. And commonly used inhalation agents include in table 119. So so we have anesthetic delivery methods: a laryngeal mask, airway or LMA, and nasal endotracheal catheter in position with cuff inflated, and the last is oral and endotracheal in intubation, which is tube is in position with cuff in inflated. So the inhalation anesthetic agents, we have the agent administration advantages and disadvantages and implication or consideration. So the agents of volatile liquids, we have flutane. So the administration is inhalation special vaporizer. So the advantages is not explosive or flammable, induction rapid and smooth, used in almost every type of surgery, low incidence of post-operative nausea and vomiting. And the disadvantages is requires skillful administration to prevent overdosage, may cause liver damage, and may produce hypotension, requires special vaporizer for administration, respiratory depression. And the implication consideration is, in addition to observation of pulse and respiration post-operatively, and blood pressure must be monitored frequently. So intravenous administration, we have intravenous administration of various substances such as barbiturates. So barbiturates means any of various drugs that are used to calm people or to make them sleep. And the benzodiazepines, that means any of group of aromatic lipophilic amines used especially as tranquilizer. So tranquilizer means a drug that causes a person or animal to become very relaxed and calm. And non-barbiturate hypnotics means is not consisting of or pertaining to barbiturates or not derived from barbituric acid, non-barbiturate sedatives. And dissociative agents, this means is this class of drug is characterized by distorted sensory perceptions and feeling of disconnection or detachment from the environment and self. And the last is opioids agents. So these opioids have the potential to cause serotonin. Serotonin means is a powerful vasoconstrictor and is found especially in the brain, blood serum, and gastric mucous membrane of mammals. And syndrome and should be used cautiously with other agents with serotonergic activity. So we have the administration of intravenous advantages of IV anesthesia or intravenous line. Onset of anesthesia is pleasant. There is none of the wheezing, roaring, or dizziness known to follow administration on an inhalation anesthetic. And the disadvantage of an IV anesthetic is thiopental or pentotal it is powerful respiratory depressant effect and sneezing, coughing, and laryngopasm. And muscle relaxants, relax muscle in abdominal and thoracic surgery, relax eye muscles in certain type of surgery, facilitate endotracheal intubation, treat laryngopasm, and assist in mechanical ventilation. So regional effects. Regional anesthesia. So regional anesthesia makes a specific part of the body numb to relieve pain and allow surgical procedures to be done. And injection of an anesthetic into the epidural space of the spinal cord. Sensation is lost in the abdominal and genital and pelvic area. Used in childbirth and gynecological surgery. So we have the epidural anesthesia and spinal anesthesia. So epidural anesthesia, goal of epidural anesthesia is to provide analgesia of pain relief rather than anesthesia, which leads to fatal lack of feeling. Epidural block the nerve impulse from the lower spinal surgeons, and this resists the decreased sensation in the lower half of the body. So, and the spinal anesthesia is in the spinal anesthesia is a procedure to medicine that numb parts in the body, so that we can feel the pain. We can feel the pain around we can feel the patient pain. We can feel the patient pain and around the spine. So these are the injection sites for spinal and epidural anesthesia. And on the right side and the left side, on the left side is cross section of injection site for peripheral nerve, epidural and spinal blocks. So we have the common use intravenous medication. So we have the medication common usage, advantages and disadvantages, and comments. So the medication of opioids analgesics. So we have morphine or sulfate, and the common usage is perioperative pain and premedication. And the advantages is inexpensive, duration of action 4 to 5 hours, euphoria, good cardiovascular stability. And the disadvantages is nausea and vomiting, histamine, a release, postural, low blood pressure, and low SPR. And the comments is use intrathecally and epidurally for postoperative pain, administration, half-life in 3 hours. And so we have local anesthesia. So local anesthesia is a numbing specific region of the body. So we have the advantage of local anesthesia are as follows. It is simple, economical, and non-explosive. Equipment needed is minimal. Post-operative recovery is brief, and undesirable effects of general anesthesia are avoided. It is dealt for short and superficial surgical. So moderate sedation analgesia is help the patient to relax. So monitored anesthesia care is a type of sedation that is administered through an IV or intravenously to sleep and patient the patient and calm during to be a calm and sleep the patient during the procedure. So that's all. Thank you.
Okay. Good day. I am Majid M. Saldi. So for the number 7 learning objective is identify the use of the nursing process for optimizing patient outcome during the intraoperative period. So nursing process is a systemic guide to client-centered care. And number 8 learning objective is describe the role of the nurse in ensuring patient safety during the intraoperative period. Then we have a 5 nursing process. We have assessment, diagnosis, planning, intervention, and evaluation. The first nursing process is the assessment. You need to assess the obtaining data, patient record, need to if there's something in the record of the patient, and psychological status like health, illness, level of consciousness, and psychosocial status like anxiety level, verbal communication problems, coping mechanism, and physical status. You need to assess that like surgical site, skin condition, and effectiveness of preparation, immobile joint. Then after you assess the patient, you need to do the diagnosis. You need diagnose the anxiety of the patient, positioning in the OR of the patient, risk for injury related to anesthesia and surgery, and disturbed sensory perception related to general anesthesia and sedation. So after the diagnosis, now going to planning in goals for care of the patient during the surgery. You need to include the reducing the anxiety of the patient, preventing positioning injuries, maintaining safety of the patient, maintaining the patient dignity, and avoiding complication of the patient. So you need that is your goals. And nursing intervention is reducing the anxiety. To reduce the anxiety of the patient, you need to introduce yourself to the patient so that he will comfortable with you, and addressing the patient by name warmly and frequent, verifying the details with providing explanation, encouraging and answering question of the patient with to do that with eye contact, and explain the details of the procedure. Preventing intraoperative positioning injuries. So we have 4 here position in the position. We have here 4 position during the surgery rather. And then letter E is the supine position. The supine position is for the abdominal surgery. And letter B, Trendelenburg position, is for the lower abdomen position. And letter C is lithotomy position, is for the perineal and vaginal surgery procedure. And letter D is the lateral position, is for the renal surgery procedure. Then protecting the patient from the injury. So to protect the patient from the injury, you need to by providing a safe environment. Then critical nursing responsibilities is verifying information to the patient, checking the chart for completeness. You need to check the chart of the patient, and maintaining surgical asepsis. Make sure the environment is asepsis and optimal, and also the materials for doing the surgery in optimal environment. It is important to review the patient record for the following: correct informed surgical consent with patient signature, and then complete records for health history and physical examination, result of diagnostic studies, and allergies of the patient. So you need to check that or review. And the last is the evaluation. Expected patient outcome, the expected outcome after the surgery. Expect patient outcome may include the following: exhibit low level of anxiety while awake during the intraoperative phase of care, remain free of preoperative positioning of the injury, so no more injury during the before the surgery, experience no unexpected threat to safety, has dignity and proceed throughout OR experience, and is free of complication like nausea, vomiting, anaphylaxis, hypoxia, hypothermia, malignant hypothermia. So it's free from that complication, or experience successful management of adverse effect of the surgery and anesthesia and should they occur. So that's it for the number 7 and number 8 learning objective.